to this prescription writing video. In the United States, there are two classes of drugs, prescription and over-the-counter. Prescription drugs require a written prescription or a telephone order to the pharmacy and can only be prescribed by a dentist. Non-prescription drugs are medications that can be obtained over the counter or without a prescription. The Food and Drug Administration regulates both prescription and over-the-counter drugs. In this module, you will learn the goals for writing scripts, the different parts that make up a script, and the importance of being complete and accurate when doing so. Though as a dental hygienist, you can never prescribe a medication for a patient, oftentimes it may be your responsibility to write a prescription for your dentist. Prescription strength toothpaste, chlorhexidine mouth rinse, or antibiotics are just a few of the medications that your dentist may ask you to write a prescription for. Frequently, it's sufficient to call them in or fill out a script on the computer, then print it out and give it to the patient. These prescriptions do not require a dentist's signature, their professional stamp will do, but if a narcotic such as pain medication is prescribed, it will have to be physically signed by the dentist and a copy filed in the patient's chart. If a prescription isn't written accurately, the pharmacist won't fill it, and a patient won't be able to obtain their medication in a timely manner. The script serves not only as an order for the pharmacist, but also as a communication tool to minimize errors in dispensing. If you're writing one out, it needs to be complete, accurate, and legible. There are three goals to writing a prescription: to generate an order for a medication to be dispensed to a patient, to communicate complete details to the pharmacist to help minimize errors, and to comply with rules that govern prescribing medication. Dentists have to order their prescription pads directly from the state. These pads shouldn't be left unattended. Having them sit out in an operatory or at the front desk, they can be stolen and forged to obtain narcotics. Let's now look at the different parts of a script. There are three of them. First, there's the heading. This contains the prescriber and patient information, the prescriber's name, address, and phone number, and the patient's name, address, and age. The patient's age is very important and often overlooked. The date's also included. The body of the script will always contain the symbol RX. This means prescription. It will have the drug name, whether it's generic or the brand name, the strength, which is written in the metric system, either in grams or liters, the quantity to be dispensed, written as this, and complete directions for use, written as this. This is the section where common Latin abbreviations are used, and these are important to know also. For instance, BID means twice a day, TID 3 times a day, PRN as needed. Table 1.5 has a list for you to study. And then also lastly, you're going to include the indications for use. Is this a pre-medication or is it for a dental infection? The last section is the closing. The prescriber's signature is included here. For some medications, the dentist's signature stamp will be sufficient, but for others, such as narcotics, the dentist has to physically sign the script. It's also going to include the dentist's DEA number, and this stands for Drug Enforcement Agency. On this particular prescription, it's on the top, but it's sufficient as long as it's somewhere on the script. It will have refill information. Even if there are no refills allowed, it's going to state that. The label checkoff box. When the physician wants his patient to know the name of the drug, the box on the prescription form marked label should be checked. Prescribers are only allowed to prescribe medication pertaining to their profession. A dentist may prescribe an antifungal medication for candidiasis or a muscle relaxer for TMJ problems, but they can't prescribe medications for things like acid reflux, even though it may be indirectly affecting their teeth. They need to be referred to their physician for that. So if we were to have a patient coming in for 2 separate appointments for non-surgical periodontal therapy and they needed pre-medication, our script might look something like this. The top of the prescription will already have all the provider's information on it since the prescription pad was specially ordered. You're not going to find a prescription pad where the provider information is blank. You would begin by filling in the patient information and the date. Don't forget to include the patient's age. Let's say that this patient is allergic to penicillin. So in this case, the patient could take clindamycin instead. They come in tablets of 300 milligrams, and for a pre-med, the patient would take 600 milligrams 1 hour before their dental appointment. To begin writing the script, you would start with the name of the drug to be prescribed, in this case, clindamycin. Alongside that, on the same line, you would include the strength of each tablet written in the metric system. So for this, it would be 300 milligrams. On the next line, you will write how many tablets are to be dispensed. Always start this line with DISP hashtag. To figure out how many tablets she will need, you might have to do a little math here. Since this patient is taking this for a pre-medication, she needs a dose of 600 milligrams 1 hour before each appointment. Clindamycin comes in 300 milligram tablets, so she will need 2 tablets for each appointment. Keep in mind here that she will be coming back on another day to finish her treatment, so you will want to include enough medication to cover both appointments. So in this case, she will need a total of 4 tablets to cover both appointments. Beneath the dispense line, you will write the dosage and directions. Always begin this line with SIG:. This means write on label. So for this patient, we would say, take 2 tabs 1 hour before dental procedure as pre-med. Once you're done with that, make sure that you specify whether refills can be dispensed, in this case, none. Make sure that the dentist's DEA number is somewhere on the prescription, and then have the doctor sign. Most of the time for pre-medication, you can use the dentist's signature stamp, but be sure that it's okay with your dentist before you do that. You may need to make a copy for the patient's chart. If the prescription was made in the computer and then printed out, then be sure to save a copy. As always, make a note in the patient's chart notes that you prescribed this medication for them.